So, ito yung mga formulas na pwede natin gamitin for creatinine clearance. Creatinine clearance rate, it is a volume of plasma that is cleared of creatinine by kidney filtration per minute. For jellyfish equation, ito naman ginagamit to for normal muscle mass and with less than 5 mg per deciliter yung serum creatinine clearance na. So, ito yung for male and for female, laging magkaiba sila ng equation. For Cockcroft equation, adequate for most adult patients with normal muscle mass then and serum creatinine clearance of less than 5 mg per deciliter. So, halos same with jellyfish. Then, yung formula natin, magkaiba din ang for male and for female. So, yung body weight natin, ito times na natin. So, 140 minus H over 72 times serum creatinine clearance for male. And for female naman, 0.85 times yung body weight natin times 140 minus yung age over 72 times serum creatinine clearance natin. Yung serum creatinine clearance natin dapat less than 5 mg per deciliter. Next natin is Sanaka equation. Ginagamit naman ito for elderly patients natin greater than 60 years old. So, for seniors with very low muscle mass and who do not have nephrotic syndrome or severe hepatic disease. It may be measured directly or estimated by Sanaka equation. So, magkaiba ulit ang pang-male natin and pang-female natin. Wherein yung ating AB dito is yung actual body weight na. Actual body weight times 19 plasma albumin level plus 32 over 100 times serum creatinine clearance for male. For female naman, yung actual body weight natin, remember, in kilograms, times 13 times yung plasma albumin level natin plus 29 over 100 times serum creatinine clearance natin. Then next, yung Schwartz equation, it is used in children. Kung yung Sanaka natin ay ginagamit for senior, Schwartz equation for children 1 to 18 years old. The formula was updated in 2009 and is currently considered the best method for estimating GFR in children. It is known as the bedside Schwartz formula. So, ito yung formula natin. 0.55 times height over serum creatinine. K is proportionately constant ranging from 0.33 for neonates natin kasi diba for children 1 to 18 years old siya to 0.7 for adolescents, for male pa rin. Then, adjusting creatinine clearance for body surface area. It is accomplished through the use of nomogram of body surface area. Example natin for adjusting creatinine clearance for body surface area. If a patient weighing 120 pounds and measuring 60 inches in height has calculated creatinine clearance of 40 ml per minute, adjust the creatinine clearance based on the body surface area. The patient's BSA is determined to be 1.5, to be adjusted 1.5 over 1.73 times 40, 34.7 ml per minute. So, ito yung sa BSA natin, yung 1.5 over 1.73. 40 natin, yun yung 40 ml per minute. The next natin, question natin is yung tungkol naman sa jellyfish and Cockcroft. Determine the creatinine clearance rate for an 80-year-old male patient weighing 70 kg, having serum creatinine clearance of 2 mg per deciliter. So, pwede talaga natin gamitin tong jellyfish at saka Cockcroft Gold. Kasi nga, less than 5 mg per deciliter yung ating gagamitin. Then, unahin natin ang jellyfish na to. Yung formula natin, 98 minus 0.8 times yung age natin ng patient ay 80 minus 20 times 0.9 over yung serum creatinine clearance natin na 2. The answer would be 22.5. Diba? Dahil 98 minus 0.8 ay 97.2 times 60 times 0.9, 45 over 2. Then, yung kakroof naman natin, yung formula natin ay body weight natin. So, 70 times 140 minus age, 80 years old, over 72 times 2. So, answer ay 4340 over 144. The answer would be 30.18. Then, next natin, abbreviations natin. Ito naman yung iba natin ginagamit dito. Once na mabasa nyo sa mga given natin na problem solving. The next, calculations involving clinical laboratory test. Clinical laboratory test or yung chemistries, analyze samples for chemicals such as yung glucose natin, cholesterol, total lipids, creatinine, bilirubin, sodium, potassium, carbon dioxide, and other substances. Units may change from milligram per deciliter to SI units of millimoles per liter of blood plasma. So, nandito yung ating normal ranges of serum chemistry values. Be familiar na lang dito sa values. Ito yung ating mga normal ranges. The next natin, how to compute. Example natin, glucose meter. Shows that a patient's blood contains 175 milligram of glucose milligram. Then express this value as milligram per ml. 175 milligram over 100 kasi percentage. Answer would be 175 milligram per ml. Next natin, the average blood alcohol concentration in fatal intoxication is about 200 milligram per deciliter. So, 200 milligram per deciliter. Ilan ang isang deciliter?